Unprecedented summer demand for health services is overwhelming hospitals in the south. Waiting lists are now at record-breaking levels, while calls to 999 were the highest on record last month. It's meant a huge rise in the number of patients visiting accident and emergency departments, many of whom are suffering with mental health issues. So just how much impact are the hospital navigators likely to make? Our Home Affairs correspondent Nikki Mitchell is here in the studio. Is there any data proving their effectiveness?
Yes, there is. A very similar scheme's up and running in Southampton. It's been running for 18 months now, and it has halved the number of young people who are returning visits to A&E. So that's quite crucial, really, in helping doctors and nurses who are facing overwhelming demand at the moment. Southampton ED's just had its busiest 3 months on record. The project's now being rolled out, that project, to hospitals in Portsmouth, in Winchester and in Basingstoke.
So where is the money coming from? And crucially, I guess, is there enough of it?
Well, it's coming from the violence reduction units, but that is coming in an annual grant form from the Home Office, so it's tenuous and it makes it difficult to recruit and to keep youth workers who don't really want to be on short-term contracts. Stan Gilmore from Thames Valley's Violence Reduction Unit told me the challenge now is to build longer-term sustainable money streams. He says it's vital, really, to get people when they're in crisis at what's called teachable moments, so when they're most likely to look at their lives and to make the changes that they need so that they don't keep coming back to A&E.
In Alistair's report, we saw the youth workers spending a lot of time with youngsters with mental health problems, but it's not just violence they're there to help with, is it?
Well, that's right, and mental health issues bring huge numbers into the emergency department. About a fifth of the young people helped in Southampton had attempted suicide. And mental health problems, they can drive young people to drugs, to alcohol. That in turn can drive them to violent crime, so it does need to be tackled. Now, I met a young man called Turlough in Southampton, and his brother took his own life, and he's had to rely very heavily on the hospital youth worker for support.
You have days where, you know, it suddenly hits you. Max isn't here anymore and won't be in 6 months, won't be in a year, won't be in 10 years. That's just it.
Max was Turlough's little brother. He was just 15 years old when he took his own life in May.
My mum just phoned me. She just said, you know, Max has killed himself. A police officer came and picked me up and brought me here. And, you know, my stepdad came out and, yeah, he grabbed me, and at that point, you know it's actually happened. And, yeah, I got taken through by Clarissa, who is one of the doctors. She's a surgeon that she had been trying to bring Max around and back to life. Go in, and my sister's there holding his hand, and, you know, my mum's in the corner just in pieces. And, yeah, just to see, you know, your younger brother, and he's there, but he's not. And then the doctor said to me, you know, there's a youth support worker outside from No Limits.
The youth worker was Kerry.
It was one of those nights where we heard the tannoy go, alerting us that a young person was coming in to resus. But unfortunately, things weren't looking great.
And I just said, yeah, I'd like to go and speak to someone, because in all honesty, if someone hadn't have been there, I don't know what I would have done. I could have easily left this hospital in a state and gone and done something stupid. I could have equally, you know, lost my head in the hospital, which no one wants. I wouldn't have wanted. I don't know how I would have been if I hadn't have spoke to you on the first day, you know, and had that hour away from everything.
Yeah.
3 months on, and Kerry's still supporting Turlough. She never knows what she'll be dealing with next. Drug and alcohol problems, children who've been stabbed, the list goes on.
Just at the weekend, I've seen 3 people related to violent crime incidents, sometimes medical stuff as well. And I just thought it was a brilliant way of capturing that moment where young people tend to be in crisis and have some time to reflect on their behaviour, the things that have brought them into the emergency department, and having that opportunity to actually speak to somebody about what help is available outside of in the community. You can't really prepare for a shift, and you do then feel a vital part of the team that are in the emergency department, because then they never know what's coming through the door either.
They have just been an absolute godsend to the department. They've seen hundreds of young people, both in the children's side and in the adult side. They've reduced the number of young people who come back to see us, allows us to deliver the service we want to deliver to these young people. It's horrible when you feel rushed and when you feel like you could do something that you can't. So having them here and able to do that, it changes everything.
The team around Max on the day was amazing, but I wanted to thank them for everything that they tried to do. And now I'm seeking the help for me.
How's your sleeping?
Turlough's also been raising money to help the youth service, which has helped him process Max's death.
It's very, heartbreaking to know that he's not going to go on to do the things that we knew he would thrive in. He was going to put me and my sister to shame with his fame. He was going to be a musician on the stage, and we were going to be there in the front row. And now that's not the case. But I think I'm dealing with it as best I can at the moment. But it's amazing to have someone on the other end of the phone that is there, that conversation is solely about making and helping you feel better, which is, the best thing right now.
Turlough Stevens ending that report by our Home Affairs correspondent Nikki Mitchell. Our best wishes to him, of course. And if you've been affected by any of the issues raised there, the BBC Action Line can guide you to help and support.